Hey, good morning. How are you today? It is morning. It is November 14th. For those of you who who aren't sure what day it is, November 14th, 2018. Are you doing okay today? Let me know how you're doing. Type in the comments below. Let me know how you're doing today. Appreciate you coming on. As always, anything you do to share this information helps. And you never know how far-reaching something you can do or say today might affect the lives of someone tomorrow. So anything you do to share what we're going to talk about today might help someone down the road. That's our purpose, helping people. So what I want to talk to you about today is the sources of stem cells. We have a lot of people that come to our office. I lecture a lot on stem cells. I teach around the country. I teach doctors and nurses around the country about stem cells and about functional medicine and functional movement. And we're trying to create a movement of doctors that are actually going to think outside the box and do things for people that actually help them heal. But there's some controversy behind stem cells. How many of you, type in the comments there. Tell me if you heard some controversy behind stem cells. Let me know what you've heard. The way I'm recording this right now, because I want to show you my screen, I can't see all your comments, but I'm going to come in and respond to them in a little bit. So I will respond to you. Again, share, hit those little like buttons, and we're going to go over the sources of stem cells. We're going to talk about something, or the controversy behind them, and where you can get stem cells, where you're going to avoid some of that controversy, if this is interesting information to you. All right, so hopefully you can still see this. So types of stem cell therapies, there's fetal and embryonic stem cells, all right? So that is where the controversy comes from. Folks, this is illegal in the United States, okay? You cannot get embryonic or fetal tissue and use it for stem cells. I'm not saying there aren't illegal ways of doing things. There's people who do illegal things all the time, but it is highly unethical in my opinion, and it is highly immoral. So nobody wants to use fetal and embryonic tissue. If that's kind of your game, great. Just don't come to our clinic or other clinics saying I'd like to use embryonic tissue for stem cells. They get them from fertility clinics. It's not from aborted fetuses when they are used for research, but you'll never get embryonic tissue for treatment in a clinic like ours or a stem cell or any other clinic that does stem cell therapy. So another source for stem cells is amniotic fluid. So amniotic fluid is obviously the fluid around a baby. Baby has to grow. It needs stem cells to do that. So there is stem cells in amniotic fluid. Depending on how that's processed, you can read some things on the internet. Some people say it doesn't have live cells. Some people say, yes, it does. It is largely dependent upon how it is processed, how they're cryopreserved, and therefore what's going to happen on the back end with those cells. Hi, Paula. Oh, I can see comments. Thanks for giving me a thumbs up there. Appreciate it. Hope you're having a great day, Paula. Great morning so far, depending on where you are. It might be afternoon. Who knows? Got people following me from South Africa now, so that's pretty cool. So you can get stem cells from amniotic fluid. Amniotic fluid, one of the great things about amniotic fluid is loaded with hyaluronic acid, which is a building block for cartilage. It's loaded with cytokines, which are little chemicals that help your body determine where things need to heal. So it kind of helps jumpstart your immune system and get your body repairing. It has a lot of tissue scaffolding, so some proteins in it that can help your body know how to attach cells to it so that we can get more cartilage growing in an area. So amniotic fluid, even if it didn't have live stem cells in it, is a great way of getting regenerative medicine. There are some companies out there that say that they can get live cells from amniotic fluid. It's not loaded with them, but it is a source of stem cells. So there's placental tissue, amniotic tissue. Now we say amniotic tissue because very carefully you have to understand that the placenta is made up of two layers, the mom side and the baby side. The mom side is called the chorion, the baby side is called the amnion. I'm going to quiz you on it later. But that placental tissue also very, very loaded with stem cells, and at least the baby side is something called immune privilege, which means it can go from one person to another without a risk of injection. So very, very good source of stem cells. Also a very good source of the tissue cytokines, the hyaluronic acid, the growth factors. It's loaded with great stuff for regenerative medicine. But again, depending on how it's processed, may or may not have live tissue. So just something to be aware of depending on the company, not the clinic that you go to, but where they are getting their stem cells from. That's important. Now, probably the thing that most people have heard about the most is this autologous. Autologous means auto means self, so they're coming from your own body. Now, there's two ways of getting your own stem cells. One of them is through bone marrow. All right, you can get them from blood. Your blood's just not loaded with them, not a great source of them. So bone marrow is loaded with stem cells, and fat tissue is loaded with stem cells. And a lot of people say, "Great, I got plenty of fat tissue. Let's rock and roll. I can get some stem cells and use my fat." Well, some upsides to using your own is that your body recognizes them very, very quickly. Another upside to that is they're almost always live cells because they pull them out of your body and spin them down in a centrifuge and inject them right back into your body. So there's no chance of them not being alive, or very little chance of them not being alive. They don't have to be cryopreserved at all. So the downside of using your own stem cells is honestly your health and your age. So I'm going to go back to another page here. Hopefully you can see this. When you're a newborn, 1 out of every 10,000 cells is a stem cell. All right. So when you're a newborn, you're like, great, that's a whole lot of cells. Fantastic. I've got tons of them. And when you're newborn, one of your stem cells every 30 days can produce about 1 billion more cells. That's incredible. So you're growing, your body repairs very quickly. My 8-year-old daughter just broke her finger. Her hand was healed in 3 weeks. Okay, so lots of stem cells. She's very young. She's got a lot of vibrancy, a lot of potency to those cells. Great to use your own when you're younger, right? By the time you're a teenager, it's only 1 out of 100,000, and by the time you're 80, 1 out of every 2 million cells is a stem cell, and one of those cells can only produce about 200 cells every 30 days. So as you get older, it's less viable to use your own. And let's face it, if you're an unhealthy person, how good is it going to be that you're using your own? Like, it doesn't even make a lot of sense to use your own. If you're on 20 different medications, why would you use your own stem cells, right? Again, I'm not against using your own. I just think you have to understand, if you're older, they're less viable, and the unhealthier you are, the less viable those are. So some of the recent research, we're talking about stuff that the FDA has come out and allowed to be changed in their regulations in just the last few months, is looking at using umbilical cord tissue. Where am I? Umbilical cord tissue for stem cells. We've known for a long time that umbilical cord blood contains stem cells. The FDA has recently said you should only use umbilical cord blood for stem cells if you're putting it back into the blood, not to joints and things like that. That's very recent. But the tissue in an umbilical cord is called Wharton's jelly. It is the cushioning around those blood vessels in an umbilical cord. And it turns out that it is the highest concentration of non-autologous, which means autologous, not your own, the highest concentration of viable mesenchymal stem cells available. So, and guess what? Lots of people are being born. So we have a reproducible source of stem cells in many of these ways, right? We don't want to use, obviously, the fetal and embryonic, but amniotic fluid, placental, using your own depending on your age, umbilical cord blood, or Wharton's jelly, which in my opinion is like, wow, that's amazing that this technology is available now. So that is the sources of stem cells. If you all have questions about, see if I can go back to the screen here. If you guys have questions about this, let me know. Type it in the comments. But we need more people to not be taking medications, right? We need people to be out of pain. Nobody likes to suffer. Nobody really wants to be on medications the rest of their life. And the vast majority of medicine is a degenerative model. The vast majority of medicine in this country and other countries is a degenerative model, which means you have a problem, you have a health issue, you go to the doctor, and they put you on a medication that is kind of designed for you to take the rest of your life. Some medications are not. You take an antibiotic, you're really kind of like, hey, we only want you to take this for a short while, fix the infection and be done. But most medications, like blood pressure medication, like acid reflux medication, like arthritis medication, is designed for you to be taking it all the time, right? So, and never stop taking it. Same with pain medication. So it's not missed on anybody. It's not missed on me. It's not missed on our patients that when you're taking these medications, if you're covering up the symptoms, your body's still degenerating, right? So if your body's still degenerating while you're taking the medication, then it stands to reason that it's a degenerative therapy. You're getting worse. Well, if you want to change that, you want to regenerate, right? You want to get your body healing on its own. Stem cell therapy, PRP therapy, prolotherapy. There are lots of ways to get your body to heal faster. You should contact clinics in your area or come to Tennessee if you'd like to. And let's talk about how to get your body better. All right, how to get your body healing. That's what we're talking about with stem cells, getting your body healing. Listen, I hope you found this helpful. Again, I really appreciate it if you would hit that share button and hit those likes for me. And they'll get the message out. This is information that people need to have regarding stem cells because there is some misinformation out there. Everybody wants to say they have the best therapy there is and we have more cells. The FDA frowns pretty heavily on those types of statements. And we like helping people, so we really don't want to make claims that the FDA would frown upon. I can tell you can go to our YouTube page and you could see testimonials of patients. These are their opinions of how they've done with stem cells over time. Hi, Cindy. How you doing today? Glad to have you on the, on Facebook this morning watching. Hope this information is helpful to you. So, but we need to be careful about what the FDA will say about what we're saying. And the reason is because the FDA, 75% of the FDA's budget is through the pharmaceutical industries. Pharmaceutical industry, unfortunately, wants you to take medication. We do not. We want your body to heal. We want you to be well. We want you living your life to its fullest. That is our goal. It's our intention. And we absolutely don't want people to suffer because they're taking medications or their family members are suffering because you are staying in bed all day. Let's face it, you don't live in a vacuum. When you're unhealthy, you're unhappy, it affects people around you. So when one person's suffering, more than one person suffers. So we want people to do well, and I hope you found this helpful. Again, show me some comments, give me some likes, and most importantly, share this with your friends and family. I will talk to you later. I have a lot to say about health. We need to talk about a lot regarding getting people well, so I'll be back at you soon. Have a great day.